2020, the state of Hawaii has required face masks to be worn to prevent the spread of COVID-19. At first, it was both indoors and outdoors. And for many months now, wearing a face mask has been a requirement when indoors, at businesses, or at work. This requirement helped prevent the spread of COVID-19, which helped prevent our healthcare system from being overwhelmed and saved lives. And because the people of Hawaii have been serious about this and other measures to prevent the spread of the virus, we have reduced COVID-19 in Hawaii to the point where most of us will be safe without masks indoors. As a result, the statewide indoor mask requirement will end on March 25th at 11:59 p.m. with the current emergency proclamation related to COVID-19. Right now, hospitalizations are trending down, case counts are falling, and we are better at treating people who are infected with the virus. Booster shots are saving lives, and the CDC rates the state's COVID-19 community level as low all across the state. This is all promising, but we've seen previous progress wiped out by a Delta or Omicron variant. So I want to be very clear. I will be ready to reinstitute the mask policy if COVID cases should surge. We are continuing to monitor the global, national, and local situation and will take the actions necessary to ensure the integrity of our state's healthcare system. I want to close once again by thanking the people of Hawaii. Our respect for one another and willingness to take the recommended actions have achieved some of the best results in the country. We are amongst the lowest per capita incidence of COVID-19 and amongst the lowest per capita deaths in the country. Even so, we have lost too many, and too many of our residents have suffered from the impacts of this pandemic. We must not forget this, and as we take the next steps in living with a pandemic that is not yet over. Thank you.
Thank you very much, Governor. Our next speaker is Dr. Elizabeth Char.
Hi, good afternoon. We have been tracking the data and studying the trends here and across the nation for many weeks. Masks are still an important tool in preventing the transmission of COVID and other respiratory viruses. The Department of Health recommends that those who are immune compromised, or kupuna, and those who are at high risk for serious illness continue to wear masks indoors. We also recommend that those who are healthy but who are around those at high risk wear masks to protect them. Indoor masks are recommended when in crowded settings and especially in public places with people you don't normally come into contact with. Finally, we recommend it when you are around those who are not vaccinated yet. Remember the basics. Get vaccinated. Vaccines work. Wash your hands often. Avoid crowded places, especially if indoors. Outdoor settings often provide much better ventilation. Stay home when you're sick or you're not feeling well. And get tested if you're exposed to someone with COVID or if you are not feeling well. Adhering to simple prevention measures will keep us moving in the right direction.
Thank you very much, Dr. Char. And our final speaker is Dr. Sarah Campbell, DOH.
Thank you. And I'll speak to new updated school guidance released this morning on our website. Our guidance revised for schools still recommends indoor masking for schools. We are dropping quarantine requirements for those exposed in the school setting, and this is one of the reasons we're still recommending masks be worn indoors in schools. Those exposed to a known positive case at school will not have to quarantine as long as they're not symptomatic or sick. Next week is spring break for public schools and others. We want to ensure that students come back to a safe environment after spring break. Maintaining indoor masking in schools for the time being is important for keeping our schools open and ensuring in-person learning. One point I want to make is that the CDC guidance is for community settings. We strongly recommend masks be worn in certain settings such as hospitals and healthcare settings, long-term care facilities, shelters, schools, and other congregate living settings such as correctional facilities. You'll still see a lot of people wearing masks. Some will do it out of an abundance of caution, others because they are at risk. So please encourage those who feel more comfortable wearing masks to continue to do so. Thank you.
Thank you very much, Dr. Kemble. And we'll open it up now to questions from reporters. If you have a question, please raise your hand on Zoom and we'll call on you. If you have a follow-up for that same question, please raise your hand again. We'll go to Jennifer Kelleher at the Associated Press. Jennifer?
I guess this question could be for any of the speakers, but what would you like people around the world to know about why Hawaii is the last to lift the indoor mask mandate?
Jennifer, Governor Ige taking that question?
You know, I do think that we put a premium on the health and safety of our community. I think all of us recognize that we impact each other and are more than willing to sacrifice personal on behalf of the broader community in general. I do believe that we are the last community to release the mask mandate because we care about each other and we care about our community, and we are all willing to sacrifice to keep each other healthy and safe. Thank you.
Thank you very much, Governor. Going on to Joel Lau. Oh, Jennifer, did you have a follow-up? Go ahead.
I'm happy to wait until a round has
Oh, okay,
gone
great. Thank you very
through.
much. Joel Lau, going on, Honolulu Civil Beat. Joel?
Hi, this is for anybody. My question is, the governor said that he would be willing to reinstate the mask mandate if needed. Would the decision be based on purely on infection rate or number of infections, or because the CDC has themselves been changing their guidelines to focus on hospitalizations? What is the state going to base its decision on?
Dr. Char taking the question.
So Joel, we take into account a number of factors. It's not any single number, but primarily it would be looking at trends. So if we see a big spike in cases and we see the hospitals filling up again, if we see just in the community that there's something going on or very, very significant outbreaks, those are all trends that we watch. We also watch what's going on the West Coast and across the U.S. And so we really are trying to keep a global focus. And if we see things trending in the wrong direction, that in conjunction with the CDC guidance, so if we moved into a yellow area, which is the medium community level, or certainly if we were into the red community level, which is a higher community level of COVID, that would spur us to make recommendations that we reinstate the mask mandate.
Thank you, Dr. Char. Going on to Allison Blair, Hawaii News Now.
Sorry, I had a follow-up, if that's okay.
Go ahead, Joel. Please raise your hand next time.
Sorry. Yes. About the statistics the state will be looking at. So if, for example, like the Omicron surge, we saw cases surge while hospitalizations remained at a lower level. If in a future surge we see infections spike, but hospitalizations remain at a manageable level, will the state be reinstating the mask mandate?
So whether or not we make a recommendation to reinstate the mask mandate depends on a number of factors, and that's partly why the CDC is looking more at hospitalizations, admissions, percentage of the patients in the hospital that are there for COVID. So those things would all be taken into account. It wouldn't just be strictly the number of cases. It really depends on a number of factors.
Thank you, Dr. Char. Allison, HNN.
Why not wait? Why wait until the mandate expires on the 25th? Why not drop it now?
You know, we continue to see case counts in the community, and the hospital still, when I checked this morning, still had 48 patients with COVID. So we do believe that it makes sense to be thoughtful as we make adjustments to the restrictions. We do believe with the safe travels expiring, we did see a lot of dropping of restrictions in the counties, and certainly we want to make sure that as the counties are dropping restrictions, that it doesn't trigger a surge in the case counts or in hospitalizations all across the state. So we do believe that it's prudent to let the emergency proclamation run its course. On March 25th, we'll be ending the Safe Travels program, and we will be ending the statewide mask mandate for indoor settings.
Thank you, Governor. Mike Brestovansky, Hawaii Tribune Herald. Mike?
Hi, Dr. Kemble, I think she said that the DOH is recommending that masks still be worn in schools. Is that to be taken as a recommendation or a mandate?
The DOH guidance for schools is guidance. So we do make recommendations based on the best available public health information. But it is guidance that the schools must take into consideration as they create their own policies and requirements.
Thank you, Dr. Kimball. Nina Wu, Star Advertiser. Nina?
Hi, this is for Dr. Char. I'm just wondering, from your perspective, once the state drops the mask mandate, do you expect the number of infections or transmission to increase, and by how much?
I sure hope that it doesn't increase. I think that's part of why the governor's been very cautious and thoughtful about this, because I think we're wanting to wait until we're in a really good place so that that doesn't happen. I think really what we're worried about is, the next surge related to another variant or something along those lines.
I believe Nina has a follow-up. Go ahead.
I was just wondering, with that being said, I know that, all eyes are on BA2, and it does look like that has increased in some places like New York City. So I'm wondering if we're keeping an eye on that and if we're concerned about it at all.
So we're definitely keeping an eye on it. You can check out the variant report on the Department of Health DocD website. We don't anticipate that we would get a large rise in cases related to the BA2 subtype of the Omicron variant, but we definitely are keeping eyes on it and watching it.
Thank you, Dr. Char. Cynthia Yip, KITV4. Go ahead, Cynthia. You have to unmute, Cynthia.
Okay, sorry about that. Passengers on city buses, will they be required to wear masks in city transportation?
Dr. Campbell taking the question.
Once the mask mandate expires under the emergency proclamation, really what we're looking at next is what is the public health guidance. Guidance remains that in crowded settings, such as on city buses where you're around people with unknown vaccination status, we would strongly recommend that you do continue to wear a mask. That's to protect yourself and also to protect others around you who may be on the bus next to you.
Thank you, Dr. Kelleher. Sorry, Campbell. Dr. Char wanted to add something. Go ahead, Doctor.
So I believe the CDC still has recommends that we wear masks when we're in that transit corridor.
Right. Cynthia, did you have a follow-up? Unmute, Cynthia.
Sorry about that. What about businesses? You're leading certain businesses to follow rules. What would happen if the businesses choose to keep indoor mask mandates? Could this cause any problems? Like if certain businesses say we want to keep it, is that going to cause a problem?
Clearly businesses do have the authority within their premise to implement any policy that they would want to. And as Dr. Kemble and Dr. Char had cited, there are situations that it would be recommended that mask wearing indoors continue. Congregate settings, as Dr. Kimball had talked about, mask wearing in schools, those kinds of situations. So clearly, a business who believes it's in their best interest to require employees or customers to wear masks indoors would be able to continue to do that.
Thank you, Governor. Moving on to Max Rodriguez, KHON2. Go ahead, Max.
Thank you. This question is for Governor Ige. Governor, do you know how many mask-related citations have been handed out? And if you could go a little over, what about those folks who are still waiting to settle those citations? What happens next?
I don't have statistics on the citations issued, but we certainly can follow up and get them. One of the reasons that we implemented citations rather than have the penalty be a misdemeanor is because we felt that would give those who break the rules or break the law the option of just paying the fine and not having to take it to court. It would not be a criminal penalty. It would be a civil penalty. And the mayors and I felt that having that option would allow easier enforcement, that the fine in and of itself would be significant deterrent to get people to comply with the action, but it wouldn't involve the rights of those accused to a jury trial, which certainly was bogging down the court system.
Thank you very much, Governor. Going back to Jennifer Kelleher, AP.
Thank you. So this question is for the governor. What changed for you when you previously announced that the mask mandate would stay in place until at least March 25? In other words, why didn't you announce this at that time? Was there something specific that convinced you that March 25 would be an appropriate time to lift the mandate? And I'm also wondering what you think about Hawaii's overall tolerance and acceptance for wearing masks, and for people outside of Hawaii, why do you think that that's the case?
I do think that we have seen the continuing drop and reduction in the number of cases, and that we're seeing the new cases, the 7-day average here statewide has dropped to 140 or so. And just a week or so ago, it was above 300. So we continue to see the trend moving in the right direction. This morning's count for hospitalized patients in the hospital is at 48, which is the first time I've seen it under 50, since probably last summer or something like that. So it's the continuing reduction in hospitalizations and COVID cases in combination with the fact that now we are more than a week into the dropping of restrictions at the county level, that we feel comfortable that the trend is continuing, and we expect that by March 25th it would be even lower.
Thank you, Governor. Moving on to Joel, Civil Beat.
Hi, Governor. I had a question about the emergency proclamation. So you said the mask mandate would expire midnight March 25th, but will Hawaii's emergency proclamation expire as well on that day?
We're working with all the counties and all the state agencies to look at whether there are specific provisions in the emergency proclamation that would be continued. Right now, my instructions to the mayors as well as the directors is to assume that all restrictions will be dropped with the emergency proclamation, and do an assessment of whether any specific exemption to law or statute would really be required. We're committed to moving the state forward and learning to live with COVID. And that also means learning to live with the normal laws and statutes that are in place. As we finish that assessment, then we will be making decisions on a case-by-case basis about what laws or rules would need to be suspended further.
Joel, did you have a follow-up?
I did. So you mentioned, or the Department of Health mentioned the hospital settings and jail settings. Just so we're clear, after March 25th, will masks still be mandated, not recommended, but mandated in hospitals and jails and other special community settings?
As of 11:59 on March 25th, the statewide requirement that masks be worn indoors will end. As we had mentioned, organizations and businesses can choose to implement restrictions that they feel would be appropriate. As Dr. Kemble had mentioned, we still recommend masks be worn in healthcare settings, in hospitals, in congregate living facilities, which would include prisons and jails. And we probably will be continuing mask requirements in those kinds of facilities, state facilities. But clearly, organizations and businesses would be able to implement whatever policies they choose to.
Thank you, Governor. Nina, Star Advertiser, go ahead.
Hi, this is for Dr. Campbell. This is related to the schools. What would be the metric or trigger for DOH to recommend dropping indoor masking in places like schools?
Very similarly to as stated for the general question of when would masking be considered again, it's not any single metric. Really, we have to consider the overall picture. And for schools, that also is looking at, unlike in the general community where we're more focused on hospitalizations, for schools it may be more about looking at absenteeism, whether in-person learning is successful given the level of community transmission of COVID. So those are the kinds of considerations we want to be looking at. We want school to be an effective learning environment. We want the value of in-person learning, but we also want to make sure it's a safe environment for everyone.
Thank you, Dr. Kemble. Max Rodriguez, KHON.
Yes, just wanted to follow up regarding public transportation, right? Like the city bus, the guidance mentioned there, wear a mask in those types of settings. So for example, if someone wants to get on the bus without a mask, will they be denied entry? Or, if someone is not wearing a mask already inside the bus, will they be asked to leave? Could you just clarify what the requirement will be there, please?
Certainly, I think you have to talk with the city and county and the bus, and each of the counties regarding what would be required in their systems. I can tell you that the CDC recommendation is that masks continue to be required in public transportation and public transportation hubs. So the CDC recommendation is that masking continue to be required on buses and in terminals. It does mention that if a bus stop is in open air, at least at the bus stop itself, that masking not be required. But the recommendation is that once you board the bus, that you should be wearing a mask. But the specific guidance will come from the counties and the bus.
Thank you, Governor. Wendy Osher, Maui Now. Wendy.
Hi, this is just a follow-up for the governor on that same question, which talked about transportation hubs. Can you clarify on what's expected at airports and airlines and airports in particular in regards to masking?
Yes, so I'm not aware of any change in the current policy right now. The current policy is that masks is required on airlines, on flights, and in the airport terminals. I am not aware of any specific change to that.
Thank you very much, Governor. We have time for one more question, going to Jennifer Kelleher, AP. Jennifer,
Sorry,
there you go.
Hi, sorry. Governor, what do you think of Hawaii's overall acceptance or tolerance all this time of mask wearing? And how would you explain that? Like, why is that the case for people outside of Hawaii?
Well, I would say that, part of it is that we are a close community, and I think we all understand that what we do impacts our neighbors and our friends. I think we have a broader sense of community here in the islands. Some like to refer to that as the Aloha spirit, about the willingness to sacrifice for others and the willingness to help others, even when people don't have much even for themselves. So I think all of that allowed us as a community to realize that sacrificing personal wants on behalf of keeping the community healthy and safe was something that overwhelmingly the majority of our residents were willing to do. And remember, in the early stages of pandemic, those most vulnerable were our kupuna. And I do think that Hawaii places high value on kupuna. And as we get to this change in learning to live with COVID, remember the ones who are not eligible for vaccination are children. And certainly I know, as I've talked with parents, they are concerned about the fact that they don't have the option to vaccinate their children. And they are hopeful that there will be a vaccination that's effective, that protects their children from serious illness. And certainly we continue to monitor the progress of vaccines for our young children at the CDC level.
Governor, any closing remarks?
So I just really wanted to thank the people of Hawaii. This has certainly been a long and relentless challenge for our community. I am proud of our response to the COVID pandemic. The fact that we continue to have amongst the lowest infection rate in the country and the lowest fatality rate in the country is really a testament to everyone being willing to sacrifice on behalf of the broader community. So just thank you so much to everyone. Certainly looking forward to March 25th when masks won't be required anymore indoors. Thank you.